Each year, Notre Dame asks, what would you fight for? And today, for the 104th time, the university answers that question. For women battling breast cancer, Tom O'Sullivan, he's at the top right of your screen, is fighting for better treatment options. And to help in that fight, this professor and his team at Notre Dame, they've developed a device to safely monitor tumors.
Now we're going to have a way to tell them this is going to work, and we have the data to prove it.
When I began working in the field of breast cancer research, I never imagined it would hit so close to home.
In 2011, 6 weeks before Tom and I were to get married, I was diagnosed with breast cancer. The treatment was brutal. I didn't feel like I was fighting cancer. I felt like I was fighting to stay alive from chemotherapy.
Seeing my wife so sick from the chemotherapy, I just wanted to know if it was working. Current methods involve X-rays or MRI contrast agents, which are things you just can't do very often. I wondered if we could use light as a safe way to monitor the response of her tumor.
Notre Dame professor of electrical engineering Tom O'Sullivan and his team have created the NearWave scanner, a handheld device that uses light to measure the progression of cancer and the effects of pre-surgical chemotherapy.
Traditionally, we wait 6 months after the onset of chemotherapy, and in hindsight are able to tell the patient if their treatment was effective.
NearWave can predict as soon as 5 days whether a tumor is responding to chemotherapy with 80 to 90% certainty. So for the ones that are not responding, we can pivot to a better treatment and spare them 12 weeks of that toxic chemotherapy.
Now we're going to have a way to tell them this is going to work, and we have the data to prove it. NearWave's potential to change outcomes is extraordinary and unprecedented in the world of breast cancer treatment.
Women need to know their treatment is working so they aren't unnecessarily sick. I'm so thankful my treatments paid off. I have a life, a career, and a family, including a daughter. I hope she won't ever need NearWave, but I want women like her to be confident about their treatment options.
The University of Notre Dame asks, what would you fight for?
Fighting for breast cancer patients.
We are the Fighting Irish.